Hello, my name is Adrienne Saint-Pierre, and I'm the curator here at the Barnum Museum in Bridgeport, Connecticut, where we have had in our collection an Egyptian mummy since 1894. We're sure that our visitors were intrigued from the very beginning when she arrived and the local newspaper announced this unusual gift. So how did the mummy come to be here? Well, none other than showman P.T. Barnum's widow, Nancy Fish Barnum, was presented with the mummy and coffin by the American consul in Cairo, Egypt. And she shipped them to Bridgeport for the Bridgeport Scientific Society, which was one of the original occupants of our historic building. Well, what do you do with a gift? You unwrap it. So the Scientific Society and the local medical society here decided to have what was called an unwinding party, and they unwrapped the human remains. That was fairly common back in those days before x-rays were invented. So after the unwinding, the skeletal remains and the coffin were on display in the museum for over a century and seen by many, many people and their children and grandchildren in the museum. Now, over the past 15 years, we've taken great strides in learning much more about the mummy, and that's thanks to advances in medical imaging and the expertise of people in the various related fields. And we've learned a great deal. This journey of discovery for us is very exciting, and we are really pleased to be able to share it with other people as we continue to learn more. Speaking with me today is Dr. Alan G. Lurie, coming from the University of Connecticut School of Dental Medicine. Dr. Lurie is professor and chair of the Division of Oral and Maxillofacial Diagnostic Sciences. So, Dr. Lurie, that's, pardon the pun, a mouthful to say, to give your title and appointments. And perhaps you could tell us a little bit more about what you do and what those terms mean.
Well, I'm a dentist and a radiation scientist by training, and I specialize in imaging the maxillofacial complex, the teeth, the facial bones, the base of the skull, and the upper portions of the neck. I teach this to dental students who are training to become dentists. I also teach this to residents who are specializing in dentistry. And I teach this area also to medical radiology residents because they don't have too much imaging education in this region. And I do a lot of administration. I interpret images on patients. I probably do 5,000, 6,000, 7,000 cases a year. And I have run residency programs and doctoral programs there, write papers, get grants, do the things that you do in academic dentistry.
That sounds fascinating and very specialized, I must say. We're going to be talking about computed tomography images that were taken of the Barnum Museum's mummy back in 2010. These are commonly called CT scans, and they were done of the Barnum Museum's mummy, first in 2006 and again in 2010 at a much higher resolution. So going back a few years, colleagues of ours, Jerry Conlog and Ronald Beckett, who are professors at Quinnipiac University and were hosts of National Geographic's The Mummy Roadshow, they were involved with us in having these high-resolution scans done. And they noticed some aspects of the mummy's jaw and dentition that they thought needed some expert interpretation. And they, as I understand it, they called upon you to see if you could take a look at these images and interpret what was going on. Can you tell me a little bit about that?
Sure, that was a very exciting event for me. Jerry Conlog was the contact person, and he had contacted some local dentists in the Bridgeport area and asked them if they would be able to do this, and they all said, no, we can't really do that, and we're not interested in doing that. And then one of them was a former student of mine at UConn and suggested that he contact me. So he contacted me and told me he'd like to know if I would be interested in looking at CT images of a 4,000 plus year old Egyptian mummy. And I said, I'll be there today if you like.
And had you ever seen images of a person who lived in ancient times before, or was this brand new to you?
Well, this was brand new to me, but I've imaged a lot of strange things being in academic radiology. I've imaged gaboon vipers that swallowed smaller gaboon vipers at the Bronx Zoo. I've imaged eggs of large ratite birds and deer teeth for the Department of Fish and Wildlife here in Connecticut. And remains of victims of foul play for the Institute of Forensics. So we're used to imaging unusual things in our program, and so I was just excited to add a mummy to this.
Sure. So what was your reaction? Were you surprised at what you saw?
No, not really. I mean, I see a lot of exams. I've seen probably well over 500,000 dental examinations on imaging in my career here. Is almost 48 years now. And so what I saw was a lot of dental disease, tremendous amount of dental disease. And some of it had gone into the bone. Some of it looked to be diet related. It was pretty much what I see every week.
Oh, but fortunately, we don't, I guess. I understand there were a lot of abscesses, and you just mentioned the word to somebody, and there's a visceral reaction. You think, oh, extreme pain. So, your insight into what this individual's life might have been like is interesting to us. Can you tell us more about how the disease and the dentition, that problems she had, might have affected her daily life even?
Well, the findings were very interesting because usually when you get an abscess, it's because you've eaten too much fermentable carbohydrates and haven't done good oral hygiene. So you get dental decay or caries, and it progresses into the pulp inside the tooth, which necroses, and then around the tip of the root down in the bone. The inflammation and infection spreads down in there, and that's when things start getting dangerous because they can escape the bone, go into spaces around the neck or up into the brain, and can ultimately kill the person if it's not dealt with. It used to be a common cause of death in the pre-bubonic plague era in Europe, and to this day is still a significant health threat worldwide.
Dr. Lurie, I wonder if you could give me an explanation of what a tooth abscess is. I mean, what is going on in the tooth at the jaw when somebody has an abscess?
Well, there are actually multiple pathologic lesions that get grouped under this term abscess. There are cysts, and there are granulation tissues, granulomas with inflammatory tissue in it, and then there are true abscesses which have pus in the middle of them. They all look the same on a radiograph, and they generally all get called the same thing in the public, which is abscess. Technically, an abscess is a cavity that's got pus in it and a lot of blood vessels around the outside, and it's enclosed unless you can drain it. And the usual treatment for an abscess anywhere in the body is that a surgeon will cut into it and try and drain the pus out, called incise and drain, I and D. And so if the abscess is within the bone surrounding the root of a tooth, how did it get there? Usually it gets there through death and necrosis of the pulp tissue that's inside the tooth. And that can happen from a fracture of the tooth or decay of the tooth, the most common cause, or it could happen in a retrograde way from a lot of periodontal disease that destroys the bone all the way down to the tip of the root. And then in a retrograde manner, it can go up and cause the death of the pulp as well. So there's this collection of inflammatory and infectious tissue around the tip of the root. And since it has nowhere to go and it is growing, it hurts. The dying pulp hurts. When the pulp is dead, it doesn't hurt anymore. Dead things don't hurt. But when it's dying, there's a lot of inflammation. That's excruciatingly painful. But once it has died, then the person is going to perceive a loss of pain, a diminishing of pain. So that makes it easier to put up with the abscess when it shows up, or if it's already there, because then the tooth isn't hurting anymore. The only nerve innervation of a tooth is pain fibers inside the pulp. There are other things outside in the ligament that holds the tooth in place that lets you kind of feel where you are as you're chewing. But the tooth proper only has pain fibers. That's all that it can tell you about. And so the pain is excruciating. But once the tooth has died, that goes away. And then you're left with this infectious inflammatory lesion where the root ends. And it's going to try and tunnel its way out or spread out through the bone marrow spaces. And that's when it becomes really, really dangerous. The best thing is if it drains itself by going right out through the jaw into your mouth. And if it can drain into your mouth, then it has done biologically what a surgeon would do surgically, which would be to cut into it and put a drain into it so that it can drain out into the mouth. But if it tunnels out into a space in your neck, then you have a whole different ballgame that can kill you. Didn't see that. Didn't see evidence of decay in her dentition. What was very evident was an extraordinary amount of wear of the teeth, particularly in the anterior regions up here. And the wear was all the way down into the pulp chambers, clearly. And so that pulp would become exposed to the oral cavity, which is loaded with microorganisms more than any place else in the body. And so that's how the pulp was compromised in her. And she had, I don't remember the exact count, but it was double digits of her remaining teeth. She was missing left-sided mandibular molars and one right-side mandibular molar, just had a couple of root pieces left. So she was missing about 5-6 teeth, and all the rest of her teeth were badly worn down in the front and all tipped around in the back. So she had what's called a collapsed dentition, which means that her bite would close more than usual, and this dimension of her face would get shorter, and the tissues around her oral cavity would compress, making her look older before her time. But the number of abscesses was really dramatic, and 2 of them were in maxillary canines, these teeth, and the so-called eye teeth. And those are especially dangerous because their drainage pathway can lead right into the brain and cause a brain abscess, and which can be fatal. I've seen 3 patients die of this in my 48 years at the dental school at UConn. One of them had perforated through the bone, and so it was draining. And so that was not a particular threat, but the other side had not perforated through the bone. So that was a distinct threat. But beyond saying that, because of the way that mummies were prepared, I can't even speculate on it.
Yes, the brain is removed, so you have no real soft tissue evidence there, and you're looking at how the disease progression has affected bone.
Yeah, not only the brain, but all of the paranasal sinus structures are destroyed when the big hook is placed in through the nasal cavity to scramble the brain before dumping it out. And so normally I would look in the sinuses for evidence of inflammation and infection that's coming up from that canine abscess, but that information also was not available. So all I had was the hole in the bone around the tip of the root of that canine, and that's as far as I could go with that.
Right. Would she have been able to eat at that point?
Yeah.
Okay.
Yeah. The people that come in with dentitions that look like this are eating.
Yes.
They may eat a soft diet, there's blenders, there's all sorts of modern conveniences that let you eat with no teeth or just a few teeth or whatever.
But for this woman, she might have been eating grain-based foods that were stone ground, and possibly that was the reason for her teeth to be so worn?
I think that's a very high likelihood, is that her diet was the source of this tremendous abrasion of her dentition. 4,000 years ago, they didn't have modern milling processes, and so when they got the wheat, they had to grind the wheat to be able to bake with it. And they ground the wheat with stones, either doing this by hand, as it's still done in several Latin American countries that make the delicious stone ground tortillas that we all love, or in large amounts by oxen or other ungulates pulling stones around in a big circle.
The old millstone.
Yeah, and the millstone, and grinding it down, milling the wheat.
Yes.
And so the stone pumices up, it gets like flour-like, and it gets into the wheat, and then that gets baked into the bread. So if you and I are eating, maybe 30 or 40 tortillas a year, it's not really going to have an adverse effect on our dentition. If we were eating 5 to 10 a day,
a steady diet,
you would be grinding your teeth down with it.
Give a little bit of context here. When the Barnum Museum received the mummy, it was in a coffin, and the hieroglyphs were interpreted, and it was learned that this was the body of a male priest by the name of Pa'ib, or as we've learned recently, was probably Paranasal, 60 years old, and a priest of the god of Min. Well, fast forward to 2006 when the first CT scans were done, and became a little suspicious that this really wasn't a man. And then in 2010, with the higher resolution scans, it was confirmed this was definitely a woman, and quite young. I mean, she was only, say, 30 or maybe at the most 40. So we sort of learned a lot in this process. And now as we're learning about her dentition and the extreme wear on her teeth, I have to wonder, somebody who died at such a young age, and possibly, we don't know, but possibly from bacterial infection caused by the dental disease. What about other people? Can we make that assumption that others of this time and place suffered from the same kind of disease?
That's a stretch. I think it's reasonable to hypothesize that this was a common way of making baked goods 4,000 years ago in Egypt, stone ground flour. And so large numbers of people would be eating a lot of baked flour products. And so you would probably find this as a fairly widespread problem, as it is in Mesoamerica. It's a problem of elderly. I have quite a bit of it in my own mouth now, but I'm 75, so that's not a big surprise. But to see it at an early age, you have to have either a really violent habit, something we would call bruxomania, which is where people are grinding their teeth in a pathologic, maniacal way. And it's pretty rare to have bruxomania that's going to cause this level of wear. You could be working in a chemical plant with erosive chemicals in the air, but in today's world, you should be wearing some kind of respirator that keeps that out of your facial orifices. So the most likely source of this kind of abrasion of teeth at a younger age is through the diet. It's not the only one, but it is by far the most likely one.
Like any of us today, we're all different in terms of our dental health. So is it possible she just had exceptionally soft teeth, that caused her to have extreme wear at such a young age?
That's a really good question. And if she had what are called soft teeth, that shows up on radiographs. Those are congenital conditions where the enamel is not properly calcified or the dentin is not properly calcified. And that has very distinctive appearances on radiographs, and she had none of that. her molar teeth that had no opponents and so had not worn down looked like perfectly normal architecturally molar teeth.
Wow, that's really fascinating that, looking at the individual teeth and whether they, would have contact with the tooth below or above can be a big clue then to what's really going on or what might have been going on.
Well, anthropologists and archaeologists have made a living off of the remains of mandibles and teeth and maxillas for their whole career. You can tell so much about the way something looked and what it ate by looking at that, whether they're fossilized remains or mummified remains. Paleontologists look at that, and archaeologists look at that, and anthropologists look at that. So there's a great deal of dental expertise throughout all of these different sciences that look at things of antiquity.
So for somebody else who might have scans of a mummy, you would say, look at the teeth, look at the jaw. Those are indicators of that person's health and possibly lifestyle.
Absolutely, absolutely.
Do you think there's a difference in, other than condition, somebody who lived thousands of years ago, perhaps the condition of the human remains are not as good as somebody who lived in more recent times. So do you have to account for that when you're looking at the images, or they're just, it is what it is there, that you can really quickly see or make an assessment that would be fairly similar to what you would see in radiographs today?
Of course, the soft tissues are going to change enormously. The skeleton is a pretty stable item, and so you can look at anthropologic remains through imaging and get a great deal of information off the skeleton, which doesn't really change too much. And the teeth change the least of anything because they are the most densely mineralized structures in the body. And the teeth of this mummy, if you look at, for example, the intact molars, they're indistinguishable on imaging from teeth that I would take a CT on you.
Wow, that's fascinating. It's also kind of sobering too, and certainly what you learned or what you were able to tell us about the condition of her dentition is, makes you stop and think how important it is to keep your teeth clean, to floss and brush.
Yeah.
So we're interested to learn about this woman who lived so long ago. It's a little bit sad to think of what she might have suffered, in the last, what would you say, year, 2 years, 5 years? How long might she have had this condition?
Probably most of her adult life.
Most of her adult life.
When the Iron Curtain came down and there was a big influx of refugees from the Soviet Union, there was a large group that settled in Simsbury, Connecticut, and also in West Hartford. Mm-hmm. And they came to us for dental care. We treated all of these people, and their dentition looked very much like Ipys. Sorry about the misname. That's how I have known this mummy since 2010. Right. Their dentition looked like hers, minus all of the wear, but the numerous teeth with abscesses were in almost all of them. And they were living in states of chronic pain. They were working, they were traveling, and they just sort of adapted to it, put up with it. People put up with pain of various types throughout their lives, and it becomes a traveling companion as you age, whether it's from arthritis or from dental disease or from headaches or whatever else hurts you. People adapt to that, and we're still very much in the dark as to the nature of pain and how one individual perceives pain can be so different than the way another individual does. So she undoubtedly had adapted to this level of dental disease and pain and went on with her life as best she could.
Well, that's extraordinary, and very interesting to know that she probably, whatever her occupation was, we don't know, although we know she wasn't royal, but whatever her occupation was, she probably just had to soldier on, doing what she needed to do.
Yep.
So, I mean, we don't really like to think about the causes of death, especially not if it involves suffering, but are we able to say that the bacterial infection caused her death, or might have caused it, or was a factor in it? What are we able to say about that?
Well, we certainly cannot say that it caused her death. There's no way to know that. We can speculate that it might have through the abscess of the canine ending up as an abscess in her brain, which back then would be fatal. But that may not have been the case. Could the dental disease that she had have contributed to other problems? Yes, it's now well known that, for example, periodontal disease has a close relationship to cardiovascular disease, which was initially shown at the Yukon Dental School. Dr. Nichols showed that. And so her dental disease was seeding bacteria into her bloodstream, and that can cause distant effects. It could modify other things that were happening to her. But it's all speculation. The only hard evidence in front of us is that she had a lot of infection in her bone, and one of them was in a particularly dangerous place.
Mm-hmm. If you could invent some new technology to answer more questions, to diagnose, and in the case of these ancient remains, is there something that you would want to see in the future that could help us understand dental disease? Or
I think that there's an ongoing hunt for being able to reconstruct what soft tissues were like based on soft tissue remains. I don't think we're going to learn new things from the mineralized tissues of the teeth and the bones, although being able to do some high-level DNA analysis sequencing may very well help with that. But I think that being able to try and reconstruct what was happening with soft tissues is going to be tremendously helpful, because then we can start looking at livers and kidneys and brains and hearts and guts and musculature, and maybe reconstruct what those tissues were like. It's sort of like paleoforensics, which is pretty exciting field.
Mm-hmm. Yeah, that's fascinating. I think I've covered the questions that I have, but I would like to give you the opportunity to share your observations or thoughts about looking at our mummy, or if you have had the opportunity to look at images from another. Am I correct that you saw the dental images of an Egyptian child?
Yes.
Maybe there's a point of comparison there.
Well, this child was so young that there was no comparison.
Oh, I see.
Jerry Conlog sent me these images and asked me to try and age this child and make an assessment of the dentition. And there was a lot of damage to the facial structures in the mummification, not just from cleaning the brain out, but there was a broken mandible and teeth were floating around off in space. So it was much more difficult to do the analysis, but there was enough left of erupted primary teeth and developing permanent teeth that I was able to get an approximate age on that child. Mm-hmm. And but that was about all that I could tell him on that one. He's also had me look at other remains, both mummified and and not. And it's been really, really interesting. Whenever Jerry Conlog sends me something, I always stop what I'm doing and deal with that, because I know there's always going to be something unusual. He sent me a lot of images that he took on remains that were below a chapel in England that he spent several weeks underground taking old style images of, because that was the only kind of equipment he could get into these catacombs. And so he was sending me images of long dead English nobility that were buried in these catacombs that had been discovered during some kind of a construction project underground.
As they often are.
Yeah,
That's usually
yeah.
the way, yes.
And I also had some experience with the mummies that fell out of the side of the mountain when they were building a road in Peru. Yes. And the mummies just started falling out of the mountainside and rolling around on the road. And one of the medical technologists at UConn went down and did a lot of the imaging with Jerry, Charlie Maklos, and the two of them imaged these mummies, and so I got to look at a lot of that stuff too. It's really, really been interesting.
Yeah, and I'm really struck by the fact that things aren't that different. When you're talking about the teeth. I mean, if we didn't have knowledge of dental hygiene and things, we would still be experiencing many of these same things that you're seeing in ancient remains. So in a way, these teeth are like time capsules, for...
Yeah, they're kind of sad time capsules, because what I see in the mummies over centuries, I see every day in walking patients that come into our clinic. And if you look at the cost of healthcare, the most effective and cheapest healthcare device ever invented by a human being is a toothbrush. It's very inexpensive, it's easy to use, it doesn't hurt, and it's very effective. And to this day, people are not using it.
It's hard to believe, but what a difference
really
it can make to your life and health, as well as you pointed out, the way we process grains today, and our diet. We know that contributes a lot to your health. So well, thank you so much for sharing your insights into the CT scans that you looked at of the Barnum Museum's mummy. We call her Ipy now, I-P-Y.
Ipy.
Yes, it's an Egyptian name that would have been, fairly common at the time she lived. And since she is no longer Paib or Pabasa, and we unfortunately don't know exactly who she is, but we wanted to give her at least an appropriate name, so we call her Ipy. But thank you so much for joining me today, and I hope our listeners have learned as much as I have about our mummy and a little bit about her life and the conditions of her life. It's been great to talk with you.
Well, thank you very much. I really appreciate being given the privilege of working with your material and doing these interpretations and being able to take part in this production.
Well, great. That's thank you. We feel the same.